collaborative network of persons living with HIV. My study proposal goes around the access to HIV testing for MSM, characterizing the population, the psychosocial factors.
The research that I will be doing with the program that is basically supported by amfAR and with specific the GMT program, as well as at Pittsburgh with the LGBT Public Health School, will be focusing on transgender community in South Africa. The importance of the whole program or the research design is to look at access to healthcare, both in primary healthcare, transgender-related healthcare, and then obviously also with HIV-related healthcare.
Our services are focusing on identifying people who are positive, but then we see all these community members who come to us and they ask us, what should we do now? And so this research is actually trying to identify how we could effectively serve the community and remove the barriers that they have while accessing treatment services.
In this project, we are intend to develop an online HIV home test service to increase the HIV periodic testing for MSM in Guangzhou, China.
So many times transgender people are undereducated and underemployed. The ones who are employed are not always employed at the level of their potential. So there's multiple reasons that contribute to the situation of trans people. And obviously all of that can have an impact also on their health, again, both in general transgender related as well as HIV related health. So the importance of this program is to try and find out barriers and also resiliences, to find out where should a program design go after this, with the gained knowledge, as well as even for funders to understand what is really the way how programs should be designed.
Since the past year, the government is actually, the healthcare departments are actually acknowledging the fact that there are MSM and trans population present in Pakistan. But this, in a way, research would help in identifying and capturing the missing gaps when it comes to linking with healthcare system by MSM and trans population.
This comes in a time in the country where there's social and political turmoil on regards to Section 53 of the Criminal Code of the country, which criminalizes same-sex activity between two men. It is punishable with 10 years imprisonment, which creates many barriers to accessing HIV testing and HIV care in the country. What we want to do is gather data that will be able to be used potentially for advocacy, as an advocacy tool, to be able to repeal or amend those laws in the country, and also be able to affect the prevalence rate of MSM in the country, which currently is at 13.85% HIV prevalence rate, being the highest in Central America and the third highest in the Caribbean.
This service will use the internet and the mobile communication technology to target the people who do not want to show up on the clinic because of maybe it's the social stigma or social discrimination, or maybe they just cannot afford for the transportation, or they don't think maybe the center is not convenient for them.
Before coming to Pittsburgh, our experience as an organization was mainly to do implementation of programs, and we relied in the very little data that had been gathered in the country. There were many gaps. Coming to Pittsburgh and being able to go through this training has given us the opportunity to be the gatherers of this data and be able to play a more important role in the national response in the country.
The program so far has been very effective in building my capacity, and it has given me the tools to effectively implement and carry out the researches when I go back in Pakistan. This will overall affect the community-based organizations, since I would be part of other community-based organizations, and it would overall affect the capacity building of an organization.
I think Pittsburgh give me a very good opportunity to think about the intervention part, and we can use a very scientific way to prove our intervention, does it effect or not.
A great advantage of the program at Pittsburgh is the fact that it's a whole semester, which you are really out of your context in your own country and can actually focus on forming academic thinking and how to create a knowledge production that will actually move the field forward.